They say it takes a village to raise a child, and our next guests aim to offer a virtual village to support mothers-to-be. Nestwell Health is Canada's first virtual multidisciplinary perinatal care clinic, founded by two former St. Francis Xavier University students. Nestwell Health is not a replacement for primary health care. It offers supplementary support to women from early pregnancy through the first year postpartum. Please welcome Ellen Cohen and Dr. Naomi Gibertson, the co-founders of Nestwell Health. Thank you so much for coming in.
Thanks so much for having us.
So let's start off with you, Naomi. What kind of services does Nestwell Health offer?
Yeah, so Nestwell Health, as you said, is an online maternity clinic that offers virtual care. So we match our women with an interdisciplinary team of trusted professionals, so registered nurses, therapists, dietitians, lactation consultants, and more to provide proactive care. So we like to see this team as working together as a collaborative group that acts as this virtual village that really takes the time to get to know each woman and her individual health needs and her goals for her pregnancy.
Okay, now they say that necessity is the mother of invention, and Ellen, this is how it came about. You actually found that you needed this in your own life.
Yeah, I was very fortunate to be connected with an OB during my pregnancy. As we know, the wait for an OB can be up to 36 weeks. But even though I was matched with an OB, I did realize that there was a lot of unanswered questions, a lot of time in between appointments. And I would turn to Google, Instagram, family and friends to have those questions answered. And I was starting to feel like I was losing control over my own health and the health of my baby. And once my beautiful daughter Annie was born, I once again felt like I had a ton of questions, and the care was completely directed to her, which is obviously great. But then again, I was turning to the myriad of resources online and trying to sift through what made sense for me, and also relying on people's experiences. So then I wanted to talk to women. So I went out in the community, I talked to women, I talked to healthcare practitioners, and got the sense that I wasn't alone. So that's when I turned to my co-founder, Dr. Gibertson, to help me solve the problem.
Yeah.
And if I may add,
Yes.
as a psychologist from New Brunswick, I'm no stranger to the gaps that exist in mental health services in the Maritimes. Nova Scotia has the highest rates of postpartum depression in the country. So women are anxious, as Ellen said, during pregnancy, they're depressed postpartum, and then they're expected to return to work, despite the fact that 95% of Canadian women receive no formal support in doing so.
Well, I love that it really hits on so many aspects of the woman's experience. Like, there's so many questions just with the health, the kind of physiological health aspects, but then the mental health aspects, and they don't know where to turn. I remember when I was a new mother, I literally had like the book out, because it was an earlier time, there wasn't so much online stuff, and I was highlighting, like I was back in university trying to learn.
Yeah.
So it's so wonderful. So how can people access this wealth of knowledge that you're offering online?
Yeah. So we have a website, nestwellhealth.ca, and you're able to go on there and sign up for your first initial consult with our registered nurse. They will develop a care plan for you, and then you will go and sign up for the rest of our services. You can also follow us on Instagram at Nestwell Health. And we encourage people, if you think this would be a service for somebody you know, to send them our way, because we're open, we're taking bookings, and we have a team waiting for mothers.
And then once you make that initial consultation with the nurse, you kind of in the system, you could, like, if you have a lactation question,
Yeah.
I could ask that. If I have a mental health question, I could ask that. That's how it works?
Exactly.
All right, so right now, there's some insurance companies actually cover the service. What are you sort of hoping for the future of Nestwell?
Yeah, so we want to increase access as much as possible so that women don't feel alone, so that they can feel connected instead. So right now, our services are available in Nova Scotia for women at any stage of their pregnancy and postpartum journey. And we understand that not all pregnancies go according to plan, so we offer grief services as well. So we're starting in Nova Scotia, and then we'll be moving to the Maritime provinces and hopefully beyond to help women across Canada.
Okay, great. Is there a timeline for that, or just, like, what are you thinking?
Yeah, so we're working on New Brunswick next. Within the next month, we hope to be up and running. So please follow us on socials and stay tuned for one will be in your province.
That's wonderful. So it's happening very quickly.
Yes.
Obviously, the demand is there. Well, thank you both for coming in. Really quickly before we go, I'll remind people how they can make that first access if they're in Nova Scotia.
Yeah, absolutely. So visit our website, nestwellhealth.ca is probably the best way. You go right to our booking site.
Yep.
But again, our Instagram at Nestwell Health is great, but our website will take you right there.
Perfect. And we put that information on our website too if you wanted to go there and find the information as well. Thank you both for coming in. Congratulations and good luck to the future.